Yeah, thank you, Rabea, for your kind words, and great to be here. Thank you for the invitation. We're a little bit late. I try to make it up like the Deutsche Bundesbahn. And so why I like to call the genetically modified animals humanized, which doesn't mean they're chimeric. And why we do that to end the worldwide donor organ shortage. Since I'm a cardiac surgeon, we focus on hearts, but together with Rabea, we have started, a successful program on kidney transplantation. Now, worldwide, approximately 4,000 heart transplants are done, and the same magnitude of patients are waiting. This is grossly underestimated, since more than that number patients receive this, you would call them artificial hearts. This is pumps, circulatory pumps, with not so good long-term results. This is my group over there. The good-looking ones are the veterinarians, not the vegetarians, the veterinarians, and the bad-looking are the anesthetists and cardiac surgeons. And so if you transplant a normal heart into a baboon, the organ is immediately rejected within an hour. So this is hyperacute rejection. Right? And so if that is survived for some reason, then you enter into thrombotic microangiopathy. So all the small vessels within the heart are blocked. And the reason is that due to the evolution, the anticoagulation systems of the two species, pig and primate, don't match. So if you want to be successful, first of all, I want to say xenotransplantation sounds dreadful, but it is actually very simple and very easy. Otherwise, it would not work, and we couldn't do it because we are just handymans and not very smart. So you need a stable genetic expression in your heart, or in the kidneys, of course, as well. And you must avoid preformed antibodies, activation of the complement system, then what I mentioned, the anticoagulation, but you can overcome that with a lot of genetic modifications. As in America, it's done, but again, we try to keep it simple and as little genetic modification as possible. And in our hands, 3 modification works. In the baboon, in the human, you would need 2 more knockouts. This is a complement regulator, and this is the human thrombomodulin, and they work for years in our hands. And so this is the genetic part. The safety part is not difficult either, because the animals, the pigs, are already very clean in laboratory conditions. Now, recently, people focus, if you look, no, that's 20, we're looking for a long time in that issue. Porcine, the animal shouldn't have porcine cytomegalovirus. This is not a cytomegalovirus, it's a herpes virus, but anyhow, it's in the pigs. We eat, we butcher, and nothing happens. And unfortunately, Mr. Bennett was the first human on our Earth who succumbed to porcine cytomegalovirus. But also baboons can succumb to porcine cytomegalovirus if the donor animal is positive. So that's our results. That's the long-term result with animals expressing or having cytomegalovirus porcine and without, there is a big difference. Unfortunately, it was obviously not very well known. The problem is that, excuse the word problem, there is no vaccine and no established, there are treatments, but they're very dangerous treatments and so on. And so they must be free. The donor also must be free of porcine cytomegalovirus. Now, another issue is how to detect it. So you can't send your specimen to a normal lab and they just tell you it's negative. And as we have seen, it's a deadly mistake. So that was mainly Antonia from Paul Ehrlich Institution. She created from the capsule of the virus a protein, and that's very sensitive. And if they tell you the animals are negative, they are really negative. Now, there's another fortunate thing is since there's no vaccine and no good treatment, you must keep the animals negative. And so, as I said, most of the pigs in Germany, we eat about 50 million pigs a year in Germany. They are positive. And so the fortunate thing is it's passed. The animals are infected via the snout, while they're drinking. And all you have to do to take away the piglet from the mother sow, let them drink the colostrum, and keep the animals in an, we call it artificial Hebamme, whatever it is. That's basically milk, yeah? And it's a clean milk, and they drink the clean milk. And then they survive, and they remain negative. So the animals must also be PERV-C negative, porcine endogenous retrovirus free. So these are, for me, the main obstacles. So that's done, safe genetics, hygienic measures. The second part of the 4 is you need non-nephrotoxic immunosuppression. Since the hearts we transplant are genetically modified, they are less immunogenic in comparison to human hearts. So your immunosuppression is less toxic. So that's a paper that Mohammed, this was one of these Maryland doctors, invented that, and it's based on CD40's antibody, anti-CD40 antibody, and of course you need thrombomodulin. Thrombomodulin, the porcine thrombomodulin, which is over here, doesn't combine very well with the human thrombin, and that's then activated protein C. But anyway, that's all. You can forget that. That blocks the conversion from fibrinogen to fibrin. And so that's very important, and it avoids, for sure, thrombotic angiopathy. So that's actually quite old paper, 2016. We used it since then with a big success. And in Mohamed's hands, the donor heart survived up to 3 years, and the medium was almost a year. It's an easy thing. You only need MMF, 1 tablet a day, and you need once a week a shot. So an anti-CD40 antibody. That's very simple. And it's now under criticism, the treatment. One thinks that you could do even with the antibody. and you don't need the MMF. So this study was done quite a while ago when orthotopic heart transplantation was not easily available in the laboratory. And so Mohammed transplanted the hearts into the abdomen, and he connected the aorta of the pig with the abdominal aorta of the recipient, and the blood left the heart via the pulmonary artery and the inferior vena cava. So, so just the heart was beating because the coronary arteries were perfused, but the heart was not included in the circulation. So it didn't add to the circulation, and the circulation was done via the recipient's own heart, which was left untouched. And so it's an immunological model, and you need a life-supporting model, and you need a consistent series of about, say 10, and 6 out of 10 should survive in good health. So that means for ease, that's just heart replacement. You take out the baboon's heart and replace it with a humanized porcine heart. And so if you do that, you run into the problem with heart preservation. So as a cardiac surgeon, you need some solution, and you keep the excised heart cool, and you can keep that for maybe 4 or 5 hours and so on, and usually the heart pump, and this is done everywhere in the world. If you do that with a pig heart, you run into a disaster. So your recipients will survive maybe in only 30 to 40%, and that's due to systolic pump failure. So we didn't know that either. So that's how it is done. That's the refrigerator. You just take out the human heart and put it in a solution and keep it in an ice box like for your Coca-Cola, yeah? And then you travel wherever you have to, where the recipient is. Yeah? But it doesn't work. It doesn't work in pig hearts, and this is in our laboratory. And just keep the picture in mind. This is the heart. It's a little heart-lung machine. You can travel with that. And in the ascending aorta, there's a huge cannula, and you perfuse the heart. The heart is not pumping. It's in a little tonus. It's a hypooncotic solution, a stain solution, and has a little hormones in, even a little bit of cocaine, and yeah, you need a little oxygen. So the little erythrocytes are in. You can question which from where they come, from the pig or from the baboon or from the human. Actually, I don't mind. They're just oxygen carriers, and the whole thing is cool. It's at 8 centigrades, and of course the pressure is very low. It's 20 millimeters of mercury, and the good ones are the red ones, and that's the most difficult graph I'm showing you this morning, and these are the bad ones. This is the cardiac index with the static technique. Like in humans, they all die. And when you compare pre and post, cardiac index, for instance, is virtually the same. And so compare the primate with the porcine heart function, and we are giving adrenaline or noradrenaline, and the amount given on catecholamines is very low, and the duration that's in hours is very low. So usually usually the animals are in the cage after a couple of hours without any oxygen, tubes without any chest tube, and sitting in the cage, and the heart is beating well. The heart beats immediately well. And since anesthetists are involved, the thing is a little bit more complicated. We have a transmitter, and we measure the blood pressure, the ECG, the temperature of the animal, aortic pressure, left ventricular pressure. We stopped measuring the left ventricular pressure. It could bleed. Aortic pressure is fine. And we have, since baboons are not very cooperative, we have a line-in, an intravenous line-in, and we can draw the blood and give IVs, and since they're all intensivists, it tends to be get very complicated. And these are all the drugs we are giving, so everything is fine. And this is just one example. I disappear now for a while, and it's the troponin is normal within days. So the creatinine is much better than my creatinine, and the bilirubin is normal, and this is the hemoglobin is 10, and we don't have transfusions. That's a LDH, and these are the platelets. Platelets remain higher. If they're low, that is a disaster. There's thrombotic microangiopathy, and then the leukocytes, C-reactive protein, and IL-6 a little bit higher within the first week, but it decreases. And so that's solved. Now, the last point was a very strange one that was vexing us, is the control of the organ growth of the hearts. They grow. And that has to do, I just abbreviate that. I always thought when you transplant the heart in a 4-kilogram newborn, then the newborn will be 18 years sometimes, and you will never have to retransplant. So the heart is growing with the body. And I thought that has to do, the heart knows it must grow because the body is bigger. It's no more 4 kilograms, it's now 80 kilograms and must enlarge. But there's a big mistake. So when a heart is born with the whole body, the heart knows how it must grow. So if you are a mouse, then it knows it only needs to be small. If you are a rat, it has to be bigger. And if you are a pig with 300 kilograms, then your heart must be approximately a kilogram. That's much too big for a 15-kilogram baboon, much too big for a human. And so you will end up with diastolic pump failure and with liver failure. And that happens in a baboon after a month or so. So the pig heart is genetically determined, knows how to grow, and it doesn't matter if the pig heart is in the pig or in the baboon. So we in the lab, we stop the overgrowth with rapamycin. That's a preclinical solution. The animals are doing well, they're in good condition. That looks like our previous results. So if you don't block the overgrowth, then the heart looks like that after a month. So there's not even a finger you can stick in the heart. There's no lumen in the left ventricle, hypertrophy, bad right ventricle. Now, we achieved the 6 out of 10 with 8 animals. So our flop was a porcine CMV. So they survived for 15 days or 27 days. So since we omitted that, we have not seen porcine CMV infection since. And so the hearts look like that, much better, big cavity, and a good pumping right ventricle. And just in brief, no immunologic reactions. This is a control animal which rejected acutely. And so in the future for humans, like in Mr. Bennett, then you can knock out the growth hormone receptor. This is a human disease. It's fortunately a monogenetic. You just knock out one gene. I can do it, but the veterinarians can do it. Then the animals remain small like the human beings. Yeah? So human beings get only a meter or something like that. And they're getting a little bit plump. But they're very healthy, no diabetes, no carcinoma. And you see the hearts are small. And they're reasonably small to get transplanted into human. Now, we have these animals. And we probably will transplant a couple of them pretty soon. James Cook discovered or took possession of Australia. He discovered New Zealand and took possession of New Zealand. They had very small sailing ships, and they couldn't eat probably the pigs they had on board. So they set out males and females of the pigs on remote islands, and they went there. They let them mate, and so they had piglets and so on, and piglets again grew. It takes 4 months for delivery and 6 months to get fertile, and so that's the way that they did that. And they couldn't eat all these animals, so a couple of these, or a lot of these animals survived on Auckland Island. That's the southern tip of the southern island of New Zealand. That's the Antarctic, and no person could ever live there. This is an awful climate over there. So it's more or less a geographic DPF unit over there for over 250 years. And we got some cells from New Zealand, and this is the Auckland Island pigs. They're most probably English descent, and they have a fur coat. They're very nice animals, very intelligent. They move. They're not fat at all, and great animals. And we must now modify them genetically. They're very clean. The females weigh 70 kilograms and the males 90 kilograms, and our animals are perf C free. So in summary, preclinical results match clinical requirements. We are planning a pilot study, and since it is our strong belief that the benefit will outweigh the risk. Now very quickly, very briefly, at the end, this is a pig how it looks like the growth hormone knockout. They had 9 other genetic modifications, and that pig heart was transplanted early this year in Maryland, and the animal was cloned. And you see it's a very similar pig. You take out the heart of the machine, and that's not in Munich, that's in Maryland. And they transplanted the heart into Mr. Bennett. Of course it worked, but when they did an echo, they found out that the aorta was torn. It's aortic dissection. It was torn all the way down. And that's, of course, a disaster. Yeah? So Bart Griffiths replaced the ascending order, and half of the arch, he is very fortunate. He doesn't understand a lot about xenotransplantation, but the patient survived, and the heart survived as well. And because he had to decrease the temperature of the patient to 80 centigrade and stop the circulation, because you must, during surgery, preserve the brain. You have about an hour's time. I think it took him, I was told, took him 30 minutes. And, but it was all torn all the way down. And this is just an anatomic drawing. And the renals are over there. Well, the renals here, the renals, renal, it was all torn here. This is the mesenteric artery supplying the bowels. And there was no blood flow in the renal artery after surgery, because it was all dissected and the vessels were blocked. They didn't care about the mesenteric artery, but it's very close. It was obviously blocked as well. So patient went into anuria and needs renal replacement therapy for 3 days, and they were lucky that's not. So what the vascular surgeons did, they put in an uncovered stent, and they pressed the inner part of the dissection to the outer part. By doing that, the lumen of the renal arteries regained a lumen, and probably the mesenteric artery as well. And but if the bowels are not perfused for a while, you end in infection. So the causes of death in Mr. Pennis were, besides PCVBE, what they overlooked, was sepsis. They found Klebsiella and enterococci in the blood before death, but there was no rejection. I admire Walton Lillehei very much. He invented cardiac surgery in the mid-50s and did all what we do first, and he was very, very hardworking. And he had lots of proverbs, and one was, experience is a great teacher. Good judgment comes from experience, and experience comes from bad judgment. And that's the end of my little story. Thank you very much.